Hunt joined Bi-State as the Community Development Coordinator in 2002, and Hunt has been instrumental and has helped several, probably many, FQHCs get established or obtain their federal funding in Vermont. Community Health Centers of Rutland were certainly one of those that benefited from his hard work and help. In 2004, Hunt was promoted to the Vermont Director of Public Policy position within Bi-State and represented the members well at the State House. For those of you who may have been fortunate enough to receive Hunt's weekly updates on policy and stuff, they are legendary. When you go to open the attachment, your computer screen dims, because set aside about half a day to go over them, He's definitely prolific. Hunt was instrumental in helping turn policy into practice and engaged and encouraged Vermont members to embrace opportunities to support their patients. As you all know, Hunt is a man of very few words. He has a fondness for those charts. Who's seen Hunt's charts? Centralized, decentralized, integrated, I was just talking with somebody earlier, and they said he has a sharp mind to be able to, grasp those charts. I don't know if sharp is the word I would use, but anyway, again, it is my honor, and truly, it is my honor to be able to present this certificate of appreciation and recognition to Hunt Blair, and I'll read the proclamation. Whereas Hunt Blair served at Bi-State Primary Care Association from 2002 to 2009, first as Vermont Community Development Coordinator and then as Director of Vermont Public Policy, and whereas Hunt Blair passionately promoted healthcare access for all with his immense personal and professional passion, commitment, and significant real contributions to lasting healthcare system changes and healthcare reform in Vermont. And whereas Hunt Blair very effectively and passionately worked with the state health policy organizations, policymakers, and payers to develop strategies, policies, and programs that use the community-based primary care system as the nexus for Vermont's healthcare reform opportunities. And whereas Hunt Blair effectively and passionately represented community health centers and primary care organizations before state and elected officials on matters of health policy and funding to serve underserved population in areas of the state. Whereas Hunt Blair passionately provided concise and timely communication to members on state policy, public policy affecting their organizations, and whereas Hunt Blair passionately and tirelessly advocated on behalf of 13 member organizations that operate over 50 sites and support or provide comprehensive primary and preventive care services to over 127,600 people in Vermont. Now, therefore, Bi-State Primary Care Association and its board of directors do hereby recognize the one and the only and extremely passionate Hunt Blair.
Thank you so much, Grant, and everybody. I'm extremely humbled by this. I really, I am passionate, it's true, but I'm passionate on behalf of all of the health center movement and all of the work that everybody in health centers and other Bi-State members do. I'm just a vehicle for, channeling your good work, and so it's just a total pleasure. I loved my job at Bi-State. I love my job now, working with Susan and Craig, and so it's just fun to do. So anyway, I appreciate it. It's incredibly nice to be honored for doing something that's so fun. So thank you very much.
You can see why it's such a great job to work at Bi-State, and not only the staff, but the former staff as well. Bi-State was just a really great, committed group, and it's